The conference was amazing. We've heard such great feedback around the speakers, the information. People are empowered. People said that we're saving lives with the content that we're sharing, which is incredible. And also the reach that we have. People were signing in from across the country and really across the world. The ability to bring people from the tech space to the public health and clinical space around a critical issue like maternal health has never been really thought about in this way. So we're excited about the speakers we had. They were amazing. Our platform worked well. People were engaged. It was a wonderful day.
I think that it was a beautiful experience for me to learn from panelists in terms of their expertise regarding technology. In the past, there has been a lot of conferences about policy, the role of nurses, the role of community health organizations, and I think this was a nice way for us to understand a different perspective when it came to how we look at and observe the Black maternal health crisis.
Just seeing this younger, emerging team of professionals who are really interested in making a difference, changing the narrative through their personal stories and work was very reassuring. They will bring the change that is needed to improve maternal health in the country.
Ultimately, Believe Her isn't just about technology. It's about building tight-knit digital communities where no mother feels alone and vulnerable on her pregnancy journey. It's about harnessing the power of technology to uplift and empower, ensuring that every woman receives the support, resources, and equitable healthcare she deserves.
While we still have the best, I think, healthcare system and healthcare institutions, I would say, in the world, we know that the disparities when it comes to maternal health are staggering. We want people to pay attention to it because if it can happen here in Massachusetts, we know, of course, it can happen in other states, and we all have a responsibility to do something.
Although this documentary is not a solution to medical racism that runs rampant in our medical system and healthcare system, it does showcase Black women's experiences in navigating the reproductive justice system in a very personal way.
I think it's extremely inspiring more to hear the stories of the individual people. Names are the most important thing when it comes to these real stories, and you hear the statistics of 3 to 4 times more. Well, what does that mean, and who are these people, and how is it affecting not only this one individual person but their families?
How many other women like us are experiencing something similar and just feel embarrassed and just feel like they can't talk about it because of how people might look at them, or if people might not think that they're strong, or might not think that they are resilient. And we are all those things and can still be up against something that is completely out of our control.
When the same thing is happening over and over, it's kind of like, you need to listen to us, you need to hear us. I think that if one person's voice is amplified and lifted up, then somebody else can see that and say, oh, I can speak up, or yeah, that's me. Like, you can resonate once you hear somebody, but if you hear nobody, then you're never gonna feel like you can talk.
So I'll use the word Ubuntu, which means stronger together. And so I think the more that we bring the masses together, the stronger the voice, the amplification is what's going to lead to change. I love the collective voice, so conferences like this are super important to spread the word.
I like to go to conferences where we are able to get thought leaders in the same building to network and to see what needs to be improved in what ways and how you can collaborate with others, because this work is only going to be achieved collaboratively, not individually.
I'm so looking forward to 2025. I know it's going to be amazing.